Time now is 6:20. Welcome back into Daybreak. Did you know that excessive sweating is a disorder? It's called hyperhidrosis, and it can be pretty embarrassing. It also complicates business and social interactions as well. In some severe cases, can have some serious practical consequences, making it hard for people who suffer to hold a pen, grip a steering wheel, maybe even shake hands with someone. Oh, I'm going to shake hands with you, Dr. Mark Jansen.
Are we
Not
dry?
too bad, right?
We're dry.
We're dry.
We're dry. Good.
Fantastic. Dr. Mark Jansen from Arkadelphia Baptist Health is joining us this morning with more information on this. So let's just talk about what is hyperhidrosis? Sweating excessively?
Well,
what is it?
Hyperhidrosis technically just means that sweat more than what is required to control body temperature.
Okay. So what is exactly the most common, who most commonly gets this exactly? What's the most common about it?
Hyperhidrosis, the condition, you know, everybody in Arkansas right now with the heat wave thinks that they have hyperhidrosis.
Yeah, absolutely.
That'd be understandable, but pathologically excessive sweating occurs in about 3 out of 100 folks. We have two different types of sweat that we make. We have sweat that we make when we're hot. It's all over the body. It evaporates in the air. It cools our body. And then we have the sweat that we make when we're nervous. For example, I might be having a lot more of that type of sweat right now talking on statewide live TV about excessive sweating. And this is a sweat that concentrates more in the armpits or axilla, on the palms, and also on the soles of the feet. When that type of sweat is excessive, we refer to that medical condition as hyperhidrosis. There are several criteria. One is that it has to be symmetrical. It has to interfere with daily activities that you do about the work or at home. It starts before age 25. Usually there's a family history. And so those are the criteria that we're looking for. Oh, it also doesn't appear at night when you're sleeping, so it goes away while we're sleeping.
While we're sleeping. Okay, so how is it treated exactly? What do you guys do?
Well,
what do you guys suggest?
there are emotional consequences of this. You know, social, emotional. If your armpits are sweating, it's, you know, you can ruin a shirt, you can ruin a blouse. It's pretty hard to have a business presentation if you're sweating through your shirt,
lifting up, and
right, if you're pointing to the thing, right?
Yes.
And so you know, there are consequences there. We all want a firm handshake.
Yes.
And you want a firm and dry handshake. You don't want a firm, wet handshake. You can have sweating that interferes with soiling of papers. Maybe you can't play musical instruments, you know, piano, guitar, brass instruments. It can also interfere with sporting activities, so golf, tennis. If you have, you know, softball, baseball, a lot of people are out on the softball field. You want the ball to go over the fence, but not the bat.
Exactly. That's a good point. So you have some suggestions here, I see?
Right. There are different treatments that are available, and so you have, first of all, the common ones. You know, we all have the antiperspirants we use. I noticed yours was quite effective this morning. I don't think we saw any stains on you.
No, no, sir.
So
undershirt helps.
But we all have the ones we use at home. But then these are prescription, some over the counter, some prescription. Aluminum salts in these, basically they plug up the pores so we don't sweat as much. Then we have medications that are oral drugs. So Robenol, others are called anticholinergics. They inhibit the amount of sweating that we make, but they can cause dry mouth, blurred vision, trouble with urinary retention, so they can be limited as far as their side effects. An interesting one is iontophoresis. There's a fancy medical term for you. Basically, you're putting your hands or your feet in a water bath.
Okay.
You have little electrodes that you use, and what those do is it creates a little current that goes through the skin. You have to stay in the bath with your hands or your feet for about 30 minutes twice a week, and that actually confuses the sweat glands so that it doesn't make as much sweat.
I like it. I like it. Confusing the sweat glands.
We have Botox. That's expensive. It's fairly painful. It's injected into the palms. It's injected under the armpits. That'll help sweating. And in very severe cases, we have a surgical procedure where nerves are cut in the upper chest, and that usually helps the sweating of the armpits or the hands, but it also can cause problems just with the surgery itself. The problem can reoccur.
Okay.
So there are treatments that are available. It's a little frustrating because they're not all perfect, but at least we have something.
Sounds good. Dr. Jansen, thank you so much for joining us. We have the Baptist Healthline number there. We'll be back with more in just a moment.